Imagine going to work only to be confronted with photos and files of disturbing crimes committed against children. That's exactly what investigators with the Internet Crimes Against Children Task Force face every day. Our Finding Hope series examines issues of mental health in order to reduce stigma and improve access to treatment. In today's installment, I'll show you what ICAC is doing to help those who spend their time helping exploited children.
You know, whether you're law enforcement, whether you're EMS, whether you're fire, you see the worst of the worst, and that's stuff that you take home with you.
For investigators with the Internet Crimes Against Children Task Force, their worst of the worst involves sexual abuse and exploitation of children online.
Unfortunately, our investigators are exposed to images as well as videos of graphic sexual acts, violent rapes, torture, and in some instances the murder of a child. And those are images and those are screams that these guys never forget.
You go home wondering, you know, is there any bottom to how low a human being can go? And no, this job has shown me that it'll always sink you a little bit further.
Regardless of how many cases investigators have seen or how many years they've worked, they cannot allow themselves to become desensitized.
If we become too desensitized to this work, then something that should bother us may not. But on the other hand, if we let everything bother us, then it affects our home life.
And having to keep cases to themselves outside of work can be isolating.
There are times that I look back at and I realize that I wasn't as engaged in family situations or friend situations.
Despite the personal repercussions this job can have on their lives, investigators remember their why.
When we are able to save a child or prevent a child from being re-victimized, and I can be like, that exposure was worth it because that child is now safe.
ICAC's current policy requires its employees to see a mental health provider once a year, but the agency recognized that one annual visit is not enough.
Currently, our agency is looking at revamping our mental wellness program,
incorporating more mental health visits and developing an onboarding and offboarding process. ICAC's commander says that the department has set aside money to invest in their mental health program, and they expect updated resources to roll out sometime this year. Reporting in studio, Frankie Catafias, 6 on your side.